had a patient come in for a consult because the dentist said if they don't fix their bad bite, then their gum recession is going to get worse. Here's what I think. When you look at these photos, you can see on the left side of the image that the top teeth are on the inside of the bottom teeth. And you can see that in these photos on the left side and on the right side, those back teeth are tipped in and the outer portion of the top teeth sit on top of the bottom teeth and even further in. So you have the crossbite. You also have the gum recession. What is gum recession? You're supposed to have a certain amount of tooth structure visible, and the gum tissue sometimes can recede or go away from covering that part of the tooth, and you start seeing more of the tooth than you should, including the root. So you can see that in the bottom right, over there by the canine, you got some premolars, you start seeing more of those tooth surfaces. Same thing on the left side over there, and even up on top, that upper left, it's actually there. The upper right canine, but it's in the upper left part of the picture. And if you look on the side view, you can see how you have that white portion of the tooth, that's the crown, and then you get a little brownish, that's the root. So we've got gum recession. You can see it on both sides. In addition, in this picture, you can see that we are missing some teeth. Missing premolars. Looks like they were taken out before. Bottom looks like we're actually missing a molar. That's the situation. What's the cause of gum recession? We're gonna break up gum recession into two general types. One that is influenced by chronic inflammation. And the second one we're gonna talk about is mechanical trauma. Of course, there's always genetics, which can influence both of those. Chronic inflammation, periodontitis, periodontal disease. The primary factor for that, chronic plaque buildup. What's plaque? Food debris on your teeth that you leave there for a long time. They get stuck around the gums. If you're not keeping your teeth clean, that leads to inflammation of the periodontal structures, like your gums and your bone tissue, which hold the tooth in place. And too much inflammation for too long, you know what happens? Then the gum tissue and the bone tissue goes away. That's no bueno. Bone loss. What happens when you get bone loss? You get gum loss. Periodontal disease is usually something that happens as we age, more so than when we're young. If you want to avoid that type of gum loss, it's easy. Just brush your teeth, stay close to your dentist, get the extensive cleanings that you need. And if you already have periodontal disease, then you need to get it under control, kind of like diabetes, chronic inflammation, get it under control and you can be healthy. The second type, remember I said, mechanical trauma. There is a theory out there that extensive brushing or too aggressive brushing on the teeth or like squeezing the teeth can lead to loss of or reduction of the periodontal structures. Some have even argued, for a long time, I think orthodontists even believed that teeth that hit in inappropriate ways is also a primary factor in gum loss. The reality is that you can find lots of people with bad bites, cross bites, excessive overbites, underbites, but they don't always have gum recession. Bad bites being a primary factor in gum loss, currently the evidence doesn't support that. Could it contribute? Possibly. So is it a bad idea to get your bite fixed? No. Okay, what about cross bites? Sometimes cross bites are noticed early on. There's two types of cross bites that we're gonna be general about. One is where your upper jawbone is quite narrow compared to your growing lower jaw. Sometimes that happens because you are an extensive pacifier user or thumb sucker that leads to the narrowing of that bone over time while we grow. Should you never suck your thumb or never use a pacifier? The reality is, if you've been a parent, then you understand that those things can be helpful, especially while we're young. But as fast as you can get rid of those habits, the better. So you have a jawbone that could be narrow, or sometimes you just have teeth, for whatever reason, that come into more narrow positions. So you've got a tooth kind of crossbite, and you've got a full jawbone type of crossbite. Well, there are two ways to resolve these crossbites. One is with a split, where your jaw that's connected in the middle can be split apart. The second type of expansion that can happen is just at the tooth level, where the tooth sitting in this different part of the bone, not the same part as the split part, where you just put pressure on those teeth and they tip out like this. They get wider. Normally when you use an expander, you actually get a little bit of both, especially if you're young. You get the split and you get the tipping at the same time. It's very predictable, and this is why orthodontists or maybe even some dentists will use expanders before the age of 10 and 11. There's a really good chance that you can get a split if you need the split. You can always get the tipping, but the split is more predictable when you're younger. Late teens and 20s, and then afterwards, you might want to consider extra support. What I mean by that is like using a mini screw or TADS connected to your expander. You put screws in your bone instead of just using the expander that's connected to the teeth, and then you crank it. As we get older and older, even that kind of treatment can be unsuccessful without the help of surgery. Yep, I'm sorry. We don't love sending people for surgery, okay? Doesn't make us happy. We do love when bites fit together well, but sometimes you have to use surgery, which is where they cut through the bone and then you do your expander and you get the split. So if you go back to those pictures, the dentist recommended using Invisalign to correct the crossbite. But in this case, I would not attempt to correct this crossbite with Invisalign if you were hoping for high degrees of predictability in the outcome. As an adult patient with a pretty significant crossbite, best bet here is to consider an expander with screws and maybe even the extra surgery or surgically assisted expansion. Now, I'm not saying that Invisalign can't fix your crossbites. It just depends on the significance of the crossbite. If you've got lots of teeth that are in crossbite, if you're trying to fix your bite to prevent gum recession, then you gotta fix it all the way. And so the idea that you could use Invisalign to fix this type of bite in order to prevent the gum recession in a predictable way, I've been wrong before, but it just seems highly unlikely, highly unpredictable. The most predictable way, tried and true, is the braces. Although there are other techniques, including Invisalign, clear aligners, removable devices that can align your teeth with adequate duration of time and force, but if you want to be able to set it and forget it, braces is the way to go. And of course, come see your tooth movement specialists and we can help you in your journey to straight teeth and beautiful bites. If you have more questions though, come find me, McKinney in Texas. We'd love to talk. That's all I got, just a little PFOing so you know where you're going. Packard out.